Okay, we're going to go ahead and get started. Hello, everybody. Welcome. I am Kim Lukey. I am the Vision Care Outreach Supervisor, and I want to welcome all of you to our webinar today. We know your time is valuable, so our goal is to keep it under an hour, and we're going to go ahead and go. So I will be presenting today, and then our other presenters today will be Clarice Williams, our Vision Care Coordinator for Southwest, Miami Valley, and Franklin, Fairfield County, Ohio. Eric Fogel, the Vision Care Coordinator for Northeast and Northwest and for all of children in Ohio. Darcy Downey, our Chapter Director for Northeast and Northwest Ohio. And Deb Shoemate, our Chapter Director for Southwest Ohio. We promise to make today's webinar educational and interactive. We will have polling questions, and as we have these polling questions, you want to use your mouse, and then you can type or select the answer when the polling question comes up. Also, we'll save at the end of the webinar a Q&A session. If you have any questions during the webinar or you think of it as we're going, you can type your questions in the chat box, which is on the lower left-hand corner of your screen. You type your message in there, or you type your question in there, and then you click on send. So we'll see the questions on there as well. There might be a slight delay on the questions. We were testing this out this morning, and where there's a little bit delay on the internet, but we'll see the questions. Don't worry if you don't maybe not see the question on your chat box. Also today, 2 lucky people will be randomly selected to win a $20 gift card from Amazon, and we will announce that towards the end of the webinar, and I'll explain more about that once we get to that portion of the webinar. So in the meantime, let's get started and let's go. So what is Prevent Blindness? We are a nonprofit public health organization, and we promote eye health and eye safety. We advocate that half of all blindness can be prevented with early detection and professional treatment. We serve all 88 counties in Ohio, and we provide direct services and education to over 800,000 Ohioans annually. We have a vast library of health and eye safety materials, which you can find on our website. And when you go on our website, if you do the search function in there, type in fact sheets, and then that'll bring up a whole library of materials that you are free to download and print off as many as you want for different facts, obviously about eye health and eyes. We also offer workplace wellness programming along with educational exhibits for museums and libraries. We also offer classroom lesson plans for schools. We provide preschool and adult vision screening training programs. We attend community health fairs and provide adult vision screenings. And each year we also put on an Aging Eye Summit. And then finally, we also support what we call a scientific research Student Fellowship Award for female scholars in vision research. This fellowship is designed to provide support for pre-doctoral female scientists committed to pursuing biomedical, behavior, or clinical research that's relevant to the Prevent Blindness mission. We also do not receive any government or United Way funding. We rely solely on voluntary contributions from in-kind individuals, corporations, foundations, and fundraising. So that's how we get our funding. So for our first poll question for today, I want to get a sense of who is in our audience today. So answer the following poll question for us. What job roles are in our audience today? So take just a second or two to type in what do you do? And we appreciate everything that all of you do for us, and your partnership with us is very valuable to us. So just looking at the answers so far, we've got a really great diverse group of people attending today, so that's really great. That's awesome. Okay, so moving on, eye health is important to us because Linda would not have been able to get her eye exam, and she went through us from Parma, Ohio, and she sent us a story, and she says, I want to thank Prevent Blindness Ohio in helping me get new glasses. I was diagnosed with diabetes 2 years ago, and my vision has changed a lot since then. My finances does not allow me to afford new glasses, and my insurance won't pay for them. If it wasn't for this program, I wouldn't have been able to get my glasses and see clearly. Thank you so much for helping me get a new pair of glasses. I can see so much better now. Okay, now we're going to go to another polling question. And this question is, which ailment is the worst that could happen to you? So you see the choices there: cancer, deafness, diabetes, heart attack, disease, HIV, AIDS, paralysis, severe vision loss, or stroke. So what, out of those ailments, what would be the worst thing that you feel could happen to you? Okay, give you just a couple seconds to answer that question. All right. And if you indicated sight, you fall along with everyone else in a national survey from the American Foundation for the Blind in 2014. 21% of Americans believe that losing their vision would have a more negative impact on their quality of life than many other health conditions. An estimated 1.8 million Ohioans are at risk for vision loss. Vision is critical to conducting our activities of daily living like reading and driving. It affects our language skills and our development learning. So, we can see just how important it is to us without, if we didn't have, our precious gift of sight. Eye health is important because, well, half of blindness can be prevented. And a story that we received from Dick Wittenberg, he would not have known that he had age-related macular degeneration. And he wrote a story that says, "This world we live in is so full of beauty, and there is little I enjoy more than being outdoors appreciating it. My name is Dick Wittenberg, and I live in Marietta, Ohio, a town that National Geographic named the adventure capital of Ohio. Whether it's wilderness hiking in West Virginia or enjoying the many outdoor opportunities in southeastern Ohio, I am continually impressed with the magnificence of this world we live in. One of the several hats I wear is Health Commissioner for Washington County, Ohio. At one of the many meetings I go to a year, there was some eye health information. In one of the pamphlets was a screening tool for age-related macular degeneration. I was amazed to discover that one of my eyes was showing signs of this disease. I had no idea. I am only 59 years old and in very good health. This led to an appointment with an eye doctor and a confirmation. I am pretty knowledgeable in health matters, but yet it took this chance encounter at a meeting to get this early diagnosis. Because it was early, I am now taking a vitamin regimen that has been proven to help me with my age-related macular degeneration. I hope to preserve the vision in my one good eye and perhaps slow the progression in the other. Eye health is too often ignored. Take my advice and see an eye doctor. I truly cannot imagine being able to do the hiking I love or to have my breath taken away by the wonders of this world. Being blind would be very hard. Very hard on me, especially with such blindness could have been, it could have been prevented. With more knowledge and more screening, we could someday end avoidable blindness. I truly hope to see that one day." Darcy, are you there? All right, folks, hit a little snag. Hold on just a second. We cannot hear Darcy. Maybe take your mute off your phone and start talking, see if we can hear you. Hello, everyone. This is Clarice. No. I can't hear you. Really? It worked before. I'm going to have to unmute all.
The conference has been unmuted.
Can you hear me now?
Darcy, I can hear you now. Go ahead.
Okay, thank you. So going on to the next polling question, it seems that 66.7% of you answered detached retina, and that is the correct answer. On the next slide, we're showing you will see the next 4 aging eye diseases. And early detection is the key in these diseases. The first one you see is age-related macular degeneration. That's a disease that gradually destroys sharp central vision. The risk factors include race, which is more common in white populations, smoking, obesity, gender, which is more common in women, and family history. The treatments that can stop or slow the progression of the disease include medications that are injected in the back of the eye, laser treatments, and vitamins, and there is no cure for age-related macular degeneration. The second picture you see, diabetic retinopathy, that is a disease that is a complication of diabetes and a leading cause of blindness that occurs when diabetes damages blood vessels inside the retina. Patches of vision loss, cloudy vision, glare sensitivity, and decreased night or low light sensitivity is associated with diabetic retinopathy. The risk of diabetic retinopathy reduced through disease management and regular professional eye exams. And we recommend that if you are diabetic, that you are getting an eye exam annually every year or more often as your doctor would prescribe. Treatments can slow the progression of diabetic retinopathy, include drug therapy and laser treatments. And again, there is no cure for this disease. The third one is cataracts, which is the clouding of the eye lens that can be successfully treated surgically by removal of the lens and replacement with an intraocular lens. Vision with cataracts can appear cloudy or blurry. Colors may seem a little bit faded, and you may notice a lot of glare and have decreased night or low light vision. Cataracts are more common after the age of 55. And the fourth aging eye disease is glaucoma. Glaucoma causes the loss of peripheral or side vision, and once that vision is lost, it cannot be restored. However, further loss of remaining vision can usually be prevented with treatments, including medicine, laser, conventional surgery, or a combination of any of these. Glaucoma is more common after the age of 40 among African Americans and people with diabetes. Eye health is important to ensure independent living.
Eye health is important because a person like a client that a social worker sent us a success story. He had a cataract, and it's from Heather, and she says, I referred one of my residents to this program after they explained to me that they hadn't had an examination in several years. At the exam provided by Prevent Blindness Ohio, the doctor detected cataracts in both eyes. Without this program, their condition might have gone untreated.
Thank you, Kim. And our next polling question reads, a dilated eye exam is necessary only if you have problems. All right. I see that the majority of you have answered correctly. It's false. Approximately 15% of Ohioans age 40 and older have some difficulty recognizing a friend across the street. 19.6% have not had an eye exam in the last 2 years. Everyone should receive a comprehensive eye exam regularly, regardless if you are having noticeable signs of problems. Healthy vision is important to your overall health and your life success. Healthy vision is something many of us take for granted, so it is important that you visit your eye doctor regularly, at least once or twice a year, or as directed by your eye care professional. Going to the eye doctor isn't just about reading the chart on the wall. It's for good eye health. So, what is a comprehensive dilated eye exam? Prevent Blindness recommends that everyone receive a comprehensive dilated eye exam regularly as recommended by your eye doctor. So what is a comprehensive dilated eye exam, and why is it so important? Because it enables your eye care professional to view the inside of your eye and closely inspect for signs of common vision problems and eye diseases, many of which have no warning signs. To dilate your eyes, drops are placed in each eye to widen the pupil, which is the opening in the center of the iris. It's the colored part of your eye. Dilating the pupil allows more light to enter in the same way as like opening a door to allow light into a dark room. Once dilated, each eye is examined using a special magnifying lens that provides a clear view of important issues at the back of the eye, including the retina, the macula, and the optic nerve. The effects of the drops usually last 4 to 24 hours, depending on the strength of the drops. Sometimes children may stay dilated longer than 24 hours. Those with diabetes should get a comprehensive dilated eye exam every year. All eye exams that are donated to the Prevent Blindness Vision Care Outreach Program are dilated eye exams. Now, we have heard that some of your clients have declined this part of the eye exam. We at Prevent Blindness strongly discourage this and urge all of you to encourage your clients not to skip this part of the eye exam. And you shouldn't either when you attend your own eye exam. Some little known fact, children's eyeballs, they do change as they get older.
Another story we received is from a grandmother for Nicholas, age 11, and the grandmother wrote to us, "Can you imagine the heaviness on my heart when a grandmother who wasn't able to provide vision care for my grandson? For 3 months, my grandson was uninsured. I was denied, delayed, and discouraged by the system. Thanks to a warm and caring school nurse and the program Prevent Blindness, who recognized a need in the community who saw young people in need of vision care, a routine screening at Arbor Elementary School led to a complete professional eye exam, which revealed stigmatism in my grandson, Nicholas' eyes. Thank you for enclosing the tip sheet. That information assisted me in making Nicholas comfortable wearing his glasses. In closing, I want to personally thank everyone in this program that is here to help and help all people in the community."
Thanks, Kim. This is Deb Shoemate, the Southwest Ohio Chapter Director. So we got another polling question. One in 20 preschoolers and 1 in blank school-age children have a vision problem. I'll give you a minute to guess that one, or if you know it. Okay, it looks like the majority of you are guessing the age of 8. Actually, the correct answer is 4. The next slide will indicate that 1 in 20 preschoolers and 1 in 4 school-age children have a vision problem. Permanent vision loss reduced ability to learn, and poor athletic performance, and low self-esteem are all factors that can affect or can be affected with vision loss. 25% of school-aged children have a seeing problem, and approximately 80% of learning is visual. The effects of all areas of learning affects physical development. Children's vision problems may be picked up at a screening by schools, pediatrician's office, or during a regular eye exam. Eye health is important because sometimes kids like Nicholas, who we just heard about, don't know that they have trouble seeing. Some signs of possible eye trouble in children include eyelids that are red-rimmed, crusted, or swollen, squints eyes or frowns, rubs eyes a lot, tilts heads or thrusts heads forward, says my eyes are itching, or says I have a headache. Your child could still have an eye problem even if he or she does not complain or does not show any unusual signs. Again, eye health is important because by the age of 7 or 8, children or a child's eye or vision is fully developed. So it's best if problems can be caught by the age of 3.
A success story from a mother for Naraya, age 7, wrote to us and said, "Many thanks to the school nurse. Nurse Katie, who identified that my daughter may need glasses. Katie informed me of the Prevent Blindness program and helped me prepare all of the paperwork. The VSP website was easy to use and helped a lot in finding an optometrist in our area. The office staff made my visit a breeze. Everyone involved was helpful and friendly. My daughter was able to get a pair of glasses that she felt very pretty in. I am happy to be able to get this program for her and get my daughter the care she needed without having adequate insurance." Which leads us to eye health is important because it's important for the holiday season. Our next polling question, are you on time for holiday Christmas shopping? Answer this question. Wait, what? Yes? Last minute? What are you, what best fits you at this time of year? Give you just a second to answer the question. I fall into the category of wait, what? Now's the time to be thinking about that, but good for you that are yes. I admire you all in that. All right, let's move on to our next polling question. And in 2014, what were the top 3 toys associated with the most estimated injuries for all ages? There are 3 of them. Select which 3 you believe were the top 3 toys associated with the estimated injuries. Was it a Barbie doll, a Frisbee, video games, non-motorized scooter, toy balls, toy vehicles, a BB gun, a bow and arrow, or a pogo stick? All right, I'll give you just a second or two to answer that question. Darcy?
Sorry about that. I was on mute. So it looks like most of you have chosen a BB gun, a bow and arrow, and toy balls. December, Prevent Blindness designates December as Safe Toy and Gift Awareness Month. The right toy can help build imagination and coordination, but the wrong toy can do more harm than good. The challenge is to find a toy your child will love and one that you know is safe. When selecting a safe toy, make sure to inspect that toy for safeness and solidness. Your child's toy should be durable with no sharp edges or points, and the toy should also withstand impact. Don't give toys with small parts to young children. Young children will have a tendency to put things in their mouth, increasing their risk of choking. It is also important to read the directions carefully and follow the suggested age guidelines. How can you keep your child safe after buying the toy is personally explain how to use the toy to the child and repair or throw away any damaged toys. Avoid all toys that fly or shoot projectiles. Keeping your child away from unsafe areas in the home. Make sure your child plays in an open area and, if necessary, under your supervision. Make a list of safety rules and share them with your child. And if your child is playing with friends, tell everyone your safety rules. Eye health is important for children's coordination and to build imagination. Kim, would you like to share the next story with us?
A story that we received from Debbie, age 55. She wrote to us the importance of regular eye exams. This is Debbie's story. I was diagnosed with glaucoma approximately 16 years ago during a regular eye exam. I was totally surprised, for no one in my family had ever been diagnosed with an eye disease, or so I thought. My optometrist referred me to a glaucoma specialist who was able to confirm my diagnosis. He then established a treatment plan for me: eye drops, laser treatments, and surgeries for drains. This has been a long and arduous journey, but with my eye disease being caught early and my ophthalmologist and optometrist working as a team, I'm happy to say that my eye pressure is maintaining a good level so that no further damage will occur, at least for now. I try to believe that something good always comes out of something bad, and this is the case with my eye disease. In sharing the discovery of my glaucoma with my parents, I discovered that my father, who had never talked about his health, also had glaucoma and macular degeneration. This was literally an eye-opener. As I learned about the disease, I discovered it was inherited. I was able to share this information with my doctors and encourage my siblings to get their eyes tested for glaucoma. This experience has taught me to get your eyes tested and the importance of having your eyes examined regularly and sharing this information with family and friends.
Okay, we have another polling question for you. How many eyeballs did Prevent Blindness save last year? Oh, where are you? They can hear you.
This is Eric, and I'm going to give you some of the guidelines to qualify for the program for both adults and children. Most of you are familiar with the program and how it runs, and we appreciate your understanding that it is important to be familiar with the details of the program. If you ever have any questions, feel free to ask us. First of all applications are submitted online. If you are issuing a template of an application to a client or family, please make sure they understand what you need from them. If they are unclear about something on the template, Please feel free to add whatever information you need to help them understand better. If you email us to let us know that a client needs to cancel an appointment, we would like to know why. Did they get insurance? Did a family member decide to pay for the vision care? Or was the time of the appointment not good and they needed to reschedule? Please have that information when you call us or email us. If you usually get a VSP voucher for adults or an SFS for children, they can be used once in a 12-month span. We do work on the honor system, but we have had people showing up at exams that have Medicaid, and we will talk about insurance next, but please ask directly. Some only know it as Paramount or CareSource or Molina. They may not even know that insurance covers exams and glasses if it is Medicaid. A hint would be consider their household income. If it is below about $9,000 per year and they say their insurance doesn't cover exam and glasses, ask what their insurance is. At that income, a lot of the time they have Medicaid and vision coverage. Excuse me. So the tricky part is Medicaid. Different Medicaid plans cover vision and care differently. It is hard to find providers that cover both the exams and the glasses, so consumers have to be knowledgeable about their coverage, and we need to be knowledgeable about their coverage. We do know that Paramount, CareSource, Ohio Medicaid, and the United Healthcare Community Plan covers exams every 2 years for healthy adults and every year for children. Molina and Buckeye Health cover exams every year for healthy adults, and of course every year for children. With glasses, the plans vary. Paramount, CareSource, Ohio Medicaid, Buckeye Health covers glasses every 2 years. The problem is finding a provider that accepts the insurance for both the exam and the glasses. So if you have a client that got their exam but is having trouble getting their glasses due to copay or allowances, let us know and we will see if we can get them a voucher. Molina covers glasses every year, and United Healthcare covers just $125 towards glasses or contacts. Children get new glasses every year. If the client needs another pair of glasses, whether they be lost or stolen or broken, they should check first with their insurance to see if they can get another pair, and if not, we can help. This applies to adults and children. So here's some do's and don'ts for the VCO program. Please don't submit an application if you don't see your name. Please contact us to add your name to the program. Please do include the annual income for the household. Please enter a numerical value even if it is 0. Please don't enter an NA or unknown. This is important information when qualifying individuals for the program. If the client exceeds 200% of the federal guideline, please don't submit the application. It will be denied. Please feel free to contact us with any questions or concerns, as I feel we have a really good rapport with our partner agencies. And now for the next polling question.
Thank you, Eric. I guess I got a little ahead of myself here. So now I will answer the polling question that you were asked a few slides ago. And I see that you all have answered it. Every year, we receive over 8,000 applications for free vision care services. Last year, through all of your efforts, just under 5,000 Ohio adults and children received free eye exams, glasses, or further follow-up ophthalmological care. All right, a little known fact for eye health is out of all the muscles in your body, the muscles that control your eyes are the most active.
A story that we received from Linda in Dayton. She wrote to us and said, I am a disabled person and I'm on a fixed income. My old glasses broke and I've been using dollar store glasses to see. It's been very hard because my eyesight has changed. I am so thankful and blessed for Prevent Blindness and East End Community Services for the opportunity to get a pair of new glasses. I can see. Thank you so very much. Okay. Thank you, PBO presenters today. Appreciate all of you. We will now open up the webinar to questions. If you typed any during the chat, I'm going to address those, and if you have any, you can add them into the chat. One of the questions that we had was vision therapy. Do we provide vision therapy? VSP will allow us to get pre-authorization. So if you have any children, clients that need vision therapy services, you would submit an application through the online portal, make a note that vision therapy is needed, and then we would mail you the gift certificate as we normally would. And then what happens is that you have to get pre-authorization. You'd go to the doctor, get the pre-authorization. The doctor would have to get the authorization for VSP, and then they would make arrangements for the vision therapy. So that does work for that. We also got a question about adding staff to use our program. When you go in the online portal, most of you will see the note that says do not submit a name or do not submit an application if you don't see your name on here. There's a reason behind that. It's because if you submit an application under Joe and you're Sue, any questions that we have are going to go to Joe. So that's why we have to have your name on there. When you have anybody that you want to add, you can email me. And my email is also on the online portal in that section, but my email is kiml@pbohio.org. But again, if you have anybody to add, when you go on the online portal, you'll see it. I had another question here that says, what's the dollar amount of 200%? Well, it changes. It's in your partner agency manual, and I also email that to everybody each time it is updated. So it's on the grid, or excuse me, in your manual in a grid. If you need a copy of that sent to you individually, you can also email me at kiml@pbohio.org, and that's KIML@pbohio.org. Or you can also email your Vision Care Outreach Coordinators, Eric or Clarice, and they could also get you that chart for the 200% of Federal Poverty Guidelines. I have another question that says, if the client returns the voucher, do we return it to you or shred it after notifying you? Yes, if that happens, email one of the Vision Care Outreach Coordinators, let them know, and also give us an explanation as to why they return it. It could be that they got an eye exam somewhere else, they got insurance, they just didn't want to use it, but we'd like an explanation. So if somebody returns a voucher, and that would be for children and adults, somebody returns a voucher back to you and they say they're not going to use it, get a reason for why they're not, and then send us an email and let us know, and then we'll make a note of it. Another question we have is, do you offer language interpreters for vision appointments? No, we don't have the resources for that. That is up to the agency or the family, friends or family can attend the eye exam with the person. Our doctors, all of our doctors have been notified that if somebody attends an eye exam and there's a language barrier, they can they won't be able to see that patient, and they would they might have to reschedule it or be turned away. So we put that in all of our materials that if somebody needs an interpreter, it's up to the partner agency and or the client to make those arrangements to have that done. Any other questions that anybody has? If you don't get a reason why they returned the gift certificate, don't go back once you've told us. I mean, I don't want anybody backtracking, but if you can try to get a reason beforehand why they return it, that's very good for us. So, that's good enough there. Does anybody have any other questions that they would like to type through on the chat? If not, you can always email any of the VCO coordinators. You can always email me. I'm sending out my email on the chat right now just in case you need it, but it is on our materials. Plenty of you have also got my email, of course, too, when I was emailing you to remind you of the webinar today. Okay, so now I want to do our final polling question for today. And what I would like some feedback from all of you is what topic, what prevent blindness related topic would you like to see in future webinars? This is something we do every year. We try to come up with new and fresh ideas every year, and because we know a lot of you have been joining us every year, and we want to change things up so that you guys don't get bored that come to us every year, and then we want to change, we want something new and fresh for you, and then at the same time we got new people that come on. So that's why we want to get ideas from you and make it more, worth your while as well, because we know your time is valuable, very valuable. All right, so I'll give you just a couple more seconds to answer that question. I do want to thank all of you for attending today. I'm going to be announcing the winners of the Vision, or for the gift card. Also, too, by the way, because we're going to advance here in just a second, there is a polling question or a survey, if you will, that pops up when you log off from the webinar. So if you want to add any feedback to that, how we did today, how was our pace, anything we need to work on to make things better, you can put that in there, and we'll take all of that definitely under consideration. Okay, so now, drum roll, don't have a drum roll, but our two winners, and you will be emailed your gift card, but the two winners today for our Amazon gift card is Jen Menue and Linda Fox. So two lovely ladies that we have worked very close with for a long time, and they are wonderful and they are great at their job. We want to thank all of you. We want to thank all of you for attending today. And congratulations to our winners. We cannot thank you all enough for all that you do and your continued partnership with us. And if you ever have any questions, comments, you can email any of us, call any of us. We're always here. We return all of our calls. And again, we appreciate all that you do for us, and of course the many other services that you provide to your clients and your community as well. So thank you very much. Have a good afternoon. Bye-bye.